am Dr. Debasish. Today I am discussed about the management of hypertension in diabetes patient. Hypertension and diabetes mellitus are the two leading lifestyle diseases in the Indian and South Asian population that often coexist due to overlapping pathophysiological factors. Obesity, insulin-resistant inflammation, and oxidative stress are thought to be some common pathway. Up to 50% hypertensive cases in India are diagnosed with type 2 diabetes mellitus. The recent RSSDI guidelines 2022 provide comprehensive recommendation for managing hypertension in patients with diabetes. 1. As per Indian guidelines, hypertension is defined as the systolic blood pressure more than 140 and diastolic blood pressure more than 90 millimeter of mercury. Primary hypertension is mostly asymptomatic, while secondary hypertension is due to various underlying pathologies. Uncontrolled BP despite the use of 3 antihypertensive drugs is referred to as resistant hypertension. Over 1 billion people suffer from hypertension globally, which is expected to rise up to 1.5 billion by 2025. Up to 50% of cases of hypertension are also diagnosed with type 2 diabetes mellitus. Hypertension presents as major risk for heart failure, CVD, CKD, PAD, ED, and end organ damage. There is a complex cause-effect relationship between hypertension and diabetes, which predispose the patients to increased risk of cardiovascular complications. For patients with diabetes mellitus and hypertension, 24 hours ambulatory blood pressure monitoring is the recommended to maintain BP targets 120 to 130 millimeter of mercury. The use of an Android sphygmomanometer must be preferred over digital devices. However, digital machines may be preferred for home-based measurement. Blood pressure there should vary the age and the common condition. Non-pharmacological management of hypertension in diabetes patients, lifestyle modification may delay the need for pharmacological intervention or can complement the BP lowering effect of drug. A low sodium diet, physical activity, and healthy diet are recommended to manage hypertension in diabetic patients. Pharmacological management of hypertension in diabetic patients, ARB are recommended as choice of the therapy of preferably in combination of CCB to the manage hypertension as its resulting complications. For combination therapy, newer CCB, example cilnidipine along with ARB are recommended. Cilnidipine is a novel, effective, and safe CCB which established for its renoprotective benefits. Combination therapy of ARB with thiazide like diuretics also reduce the risk of renal disorders. While telmisartan can be first-line ARB to treatment of diabetic hypertension due to its beneficial effect on fasting blood glucose and insulin levels, alternatively, agilsartan and similar safety and efficacy profile is also recommended. Thiazide diuretics can be preferred in elderly patients with existing CVD. ACE inhibitors may be used as an alternative ARB to ARB for cardiovascular disease risk reduction in high-risk patients. Beta blockers may be preferred in patients with previous history of CVD and as an alternative to RAS blocker in pregnant women. Summary: hypertension is a strong modifiable risk factor for the macrovascular and microvascular complications of diabetes. Strong evidence from clinical trials and meta-analysis supports targeting blood pressure reduction to at least 140 by 90 millimeter of mercury is in most adults with diabetes. Lower blood pressure target may be beneficial for selected patients with high cardiovascular disease risk if they can achieve without undue burden, and such lower targets may be considered on an individual basis. In addition to lifestyle modification, multiple medication classes are often needed to attain blood pressure goals. Thank you.